Hi, my name is Lindsay Page. I did my volunteer hours at an outpatient mental health clinic called Resurgence Counseling Center in Lexington. Resurgence is owned and operated by a licensed clinical social worker named Jennifer Webb, and she has hired several other certified and licensed social workers to provide counseling to mostly women, but they do have a few men scattered across their patient population who are struggling with substance abuse issues, trauma, grief, anxiety and depression, anger management, and lots of other mental health issues. I had originally planned to do my volunteer hours somewhere else and kind of hit a roadblock with that. So I approached Jen to see if she had any suggestions, and she had a couple of really good ideas. One of the things that she mentioned is that she felt like patients with Medicaid can have a difficult time finding access to mental health care. Her office was recently credentialed with Medicaid, so she wanted to get the word out that they could see patients with Medicaid. I have a child who has Medicaid, and we have been on a wait list for some therapy for over 6 months with 3 different facilities. Received a letter in the mail last week from one place that basically said, we know you've been on the wait list for 6 months. We still have no idea if and when we will be able to see you, but let us know if you want to keep waiting. So my child, who absolutely needs some help with a few things, has had to wait this long. We're doing okay. We're managing fine for the time being. But then I kind of started to think about these people who could be trapped in addiction, or who are suicidal, or who just are depressed and miserable, or struggling to heal from abuse, and they can't get the help they need because no one has the availability for them or takes Medicaid. So I felt like if I could help just kind of get the word out about Resurgence, and that, they have 3 licensed clinical social workers with the same week availability for patients with Medicaid, that might be, a good way to get people some help. So I did research on about, really any organization that I could that would routinely be in contact with patients with Medicaid. So I started to research DV shelters and food banks, churches, homes for unwed, pregnant teens and women, even some doctor's offices that I knew had a high Medicaid population. I created some electronic flyers and made some bios for our clinicians, and I kind of shotgunned those out to all of those organizations that I found. So thankfully we've had some really good feedback, and we've already started to schedule some Medicaid patients. So I was pretty excited about that. I didn't really come across too many challenges, thankfully, but this assignment really did kind of help me to see and understand all of the different hats that social workers have to wear. Within my 25 hours, I did research about the different organizations in the area. I networked and made connections and relationships with those people. I did some marketing and learned how to use new editing software. I learned a lot about how underserved people with Medicaid really can be, and just the lack of access that they have to, good mental health care. While I obviously didn't provide therapy or anything like that to anybody, I'm really thankful for the opportunity to help the people in the community that I live in get the mental health care that they need. So I enjoyed this assignment immensely, and think that this class is going to help me out quite a bit in my goal to become a social worker.